Welcome, Sky Community, to another episode of Sky Women. Today, we are talking all about birth control. This is really a big topic, and I'm going to try to really keep it simple. Okay. So, what should you think about when choosing a birth control method? Number one, how well does it actually prevent pregnancy? How easy is it to use? How easy is it to get? Because some types of birth control are going to require prescription and you have to see a healthcare professional or go to a clinic to get them. And whether it protects against STDs. And do you have any healthcare problems? So, several things to consider. How well is it going to prevent pregnancy? How easy is it to use? Are you actually going to use it? Because the best form of birth control is the birth control that you actually use. Okay. If you have certain diseases or medical conditions, some birth control methods may not be recommended. So you need to talk to your healthcare provider to kind of look at the risk and the benefits of each and decide which is the best option for you. A very common question is, do I need a pelvic exam in order to get a birth control prescription? And it is not needed for most forms of birth control, except for an intrauterine device. Diaphragm or cervical cap would also need to be fitted, and some providers are very comfortable fitting those if that's something that you choose to use. And we'll kind of walk through each one of these. The best method for preventing pregnancy, other than abstinence, is a tubal sterilization if you want something that's permanent. With permanent sterilization, what we often do now is what we call an opportunistic salpingectomy, and we actually remove the fallopian tubes. And with removal of the fallopian tubes, we believe it to be a primary prevention of ovarian cancer in a woman who's already undergoing pelvic surgery. We typically will go ahead and do this if somebody's having a hysterectomy, but if you're wanting to have it for tubal sterilization, it's safe and it doesn't increase the risk of complications such as blood transfusions or readmission to the hospital or postoperative complications such as infections or fever compared to a regular tubal, which in the past has been a clip or a tie or a burn or something called a fulguration, where we actually burn a midsection of the fallopian tube, essentially interrupting the sperm and the egg from meeting. So we actually remove the fallopian tubes now, and this can reduce your risk of ovarian cancer because we believe that some of the primary peritoneal cancer, scratch that. Ovarian function is not affected by a salpingectomy. Okay, let's discuss hormonal birth control methods, okay? With hormonal birth control methods, we have pill, the patch, and ring. So how does it actually work? Hormonal methods of birth control contain hormones that prevent pregnancy. How do they do this? The hormones that are made by the body to control its functions, the birth control, scratch that. Welcome, Sky Community, to another episode of Sky Women. Today, we are talking about birth control, all things related to birth control. What should you consider when choosing a birth control method? One is how well it prevents pregnancy. And we've got everything from barrier methods to pills to patch to NuvaRing to Depo-Provera injection to implant devices like the IUD and the Nexplanon that implants in the arm. So we're going to walk through all of these and kind of go through risk and benefits. But the best kind of birth control is the birth control that you actually use. So you have to consider, how well does it prevent pregnancy? What do I want for my family planning and spacing of kids? How easy is the birth control to use? How easy is it to get? Because sometimes a birth control are going to require a prescription and you have to see a healthcare professional or go to a clinic to get them. Does it protect against sexually transmitted infections? If you're having sex, you also need to protect yourself from STIs. And what kind of health or medical conditions do you have? Because some birth control methods may not be recommended. You should talk with your healthcare professional about any possible risk and the safety of each method to find out the best option for you. Okay, so not all, actually very few birth control methods are going to require you to have a pelvic exam in order to get the prescription. Okay, so I hear this a lot where providers are withholding the birth control prescription until you come in for your annual exam. That's not really necessary, and that's really an outdated practice. A pelvic exam is really only indicated or necessary for an intrauterine device, unless you have some abnormal bleeding or something else going on, or for a diaphragm or cervical cap that may be fitted. And you also might need STD or STI, sexually transmitted infection testing, before you start a birth control method. Okay, which birth control methods are best at preventing pregnancy? Other than abstinence, a tubal ligation actually would be the best if you're wanting permanent contraception, okay? So if you're done with your childbearing years or you do not want to have children, then having your tubes tied or removed is the best way to prevent pregnancy, the most effective. We typically nowadays do an opportunistic salpingectomy, which means that we actually remove both fallopian tubes as opposed to cutting out a midsection of the fallopian tube. We, instead of just interrupting the connection of the fallopian tube so that the sperm and the egg cannot meet, we actually remove the entire fallopian tube as a primary prevention of ovarian cancer. There is no increased risk to this procedure versus someone who's just having a normal tubal ligation. There's no increased risk of need for a blood transfusion or readmission to the hospital or postoperative complications like infection or fever. So very safe and very easy to do and highly effective. Okay, next would be our IUD. Scratch that. Okay, but let's talk about hormonal birth controls and how they work, okay? When we're talking about hormonal birth control methods, we have, we're going to talk specifically about the pill, the patch, and the ring, okay? The hormones in the birth control keep a woman's body from releasing an egg each month, so they're suppressing ovulation. And if your body does not release an egg, you can't get pregnant. Some methods also thicken the mucus in front of the cervix, which helps to prevent sperm from entering the uterus and also thin the lining of the uterus. Hormone methods are safe for most young women, and they work well when they're used as directed. So that is one of the issues, right? It's how easy is it to use, and are you actually going to use it? Because if you're missing your pills or you're forgetting to put your patch back on, you're going to have spotting between periods. It's not going to be as effective, and you're more likely to have a pregnancy. So birth control pills, also known as the pill, is the most common hormone method used. You have to take the pill every day at the same time every day. There are many types of birth control pills. It's hard to even keep up with. A healthcare professional can help you kind of choose which one is right for you. And sometimes it takes a little trial and error to figure out which one's going to work best for you. If you miss a pill, you need to know what to do. You've got to read the instructions that came with your pill pack and know how to kind of catch up and contact your healthcare professional if you've missed more than 2 pills. Okay, what is the skin patch? So it's a small adhesive patch that's worn on the skin. It contains hormones that prevent pregnancy, estrogen and progesterone. A new patch is worn for a week at a time for 3 weeks in a row. And during the 4th week, the patch is not worn. And that's when you'll have your period. You can put this patch on your buttocks, on your chest, except for your breast, your upper arm, your back, or abdomen. And the patch can be worn during activities like bathing, exercising, swimming. The vaginal ring is a flexible plastic ring that you insert in the upper vagina, and it releases hormones that prevent pregnancy. The hormones are slowly released into your body, and it's worn inside the vagina for 21 days and then removed for 7 days. And during the 7 days, that's when you'll have your period, and then you insert a new ring. So it's really important that you're tracking your periods, that you're marking on your calendar, you're setting a reminder. If it were me, I would absolutely forget to put in that new vaginal ring. Okay, and the birth control shot. So this shot, Depo-Provera, is given in the upper arm or the buttocks every 3 months, and it contains hormones that prevent pregnancy. The birth control shot may be a good choice if you can't remember to take the pill. Okay, the implant. The implant's Nexplanon. It's a small plastic rod about the size of a matchstick that a healthcare professional is going to insert under the skin of the upper arm. It releases a hormone that prevents pregnancy, and the implant is approved for up to 3 years of use. It can be a good choice if you can't remember to take the pill every day, you don't want to bother with the patch or inserting the vaginal ring, or getting the Depo-Provera injection. Now we're going to run through kind of risk and benefits and side effects of each one of these in a little more detail here in a minute. Okay, let's talk about an IUD and how it works. I love IUDs. I'm a huge fan. If you're a patient of mine, you know that I sing their praises all the time. But let's talk about how it works. An IUD works mainly by preventing fertilization of the egg by sperm, okay? So the progesterone in a hormonal IUD thickens the mucus found in the cervix. The thicker mucus make it harder for the sperm to enter the uterus and reach the egg. Progesterone also thins the lining of the uterus. So that's how a progesterone IUD works, like Mirena or Liletta or Skyla. The copper IUD actually doesn't have any hormones. It's just a foreign body effect, and it stops the sperm from moving and reaching an egg. Once the IUD is inserted, nothing else needs to be done to prevent pregnancy. The IUD has a string that can be checked to be sure the device is in place. The strings are usually cut 2 to 3 centimeters in length, and they are outside of the cervix, but they're very high up in the vagina. They curl up next to the cervix. And so it's not like a tampon string. It's up in the vagina. No need to worry about that. Okay, so let's talk a little bit about combined hormonal contraception. If you're older than 35 years and you smoke or have a history of blood clots or breast cancer, your doctor is going to advise you not to take this pill, okay? Typical failure rate is around 7%. There is progesterone only pill, unlike the combined estrogen and progesterone pill. This one is progesterone only, and it can be used if you have indications, for not being on estrogen, such as having a blood clots or issues like that. On the patch, the skin patch is worn, we talked about it on the lower abdomen, the buttocks, the upper body. It's prescribed by your doctor. It releases progesterone and estrogen in the bloodstream. Let's start over. Welcome, Sky community, to another episode of Sky Women. Today, we're talking all about birth control. Birth control, also known as contraception, is designed to prevent pregnancy. Birth control methods can work in a number of ways, preventing sperm from getting to the eggs. Like certain types that can do this are welcome, Sky community, to another episode of Sky Women. Today, we're talking all about contraception. Your choice of birth control should be based on several factors, including your health and any health conditions that you may have, how often you have sexual activity, how many sexual partners you have, whether or not you want to have children in the future, how easy it is to use, how easy it is to access, right? There's several considerations to take in, and your healthcare provider can definitely help you to choose the best form of birth control for you. Birth control can act in several different ways: preventing sperm from getting to the eggs, keeping the ovaries from releasing eggs that could be fertilized, and sterilization. And IUDs. Hello, Sky community. Welcome back. Today, we're going to talk all about contraception, and this is a big topic. There are a lot of options out there for birth control, which is phenomenal, and I want us to all be aware of them, especially with what's going on with the attacks on abortion and things like that. I mean, we absolutely have to be in control of our reproductive health and protecting ourselves. We are sexual beings. We are going to continue to fall in love and to have sex. And so we really have to take into consideration, how do we protect ourselves against pregnancy and sexually transmitted infections? So what do we need to think about whenever we're choosing a birth control method? What are your health care, or what are your health conditions? Do you have any medical conditions that may limit your use of birth control? You need to talk to your healthcare provider about this, about any possible risk and the safety of each method, to find out which one is best for you. You also need to consider, how well does it prevent pregnancy? How far apart do you want your children to be? How easy is it to use, and how easy is it to get? And does it protect against sexually transmitted infections? So let's just run through some of the options. First of all, like, do you need a pelvic exam? This is a very common question they get. Do I need a pelvic exam in order to get my birth control, right? Sometimes providers will withhold birth control prescription in order to get you in for your annual exam. You don't actually need a pelvic exam for most birth control options, except for the IUD, perhaps if you're being fitted for a diaphragm or cervical cap. The intrauterine device is a long-acting birth control method, and long-acting reversible contraceptions are by far my favorite. Contraceptions help prevent people from getting pregnant and from catching infections during sexual activity. And it's important for us to know what our options are. Long-acting reversible contraceptions are some of my favorite. They're most effective contraceptives to preventing pregnancy. Less than 1% of users become pregnant during the first year using them. You will hear long-acting reversible contraceptions called LARC, and they are placed by your healthcare provider, and they do have an indication for helping with heavy or painful periods. So this is one of the reasons why LARC is my favorite, especially the IUD. There are two kinds of long-acting reversible contraception. That's the intrauterine device and the subdermal implant. And so we're going to go through those in detail. It is important for me to say here that condom use is required even if you have a long-acting reversible contraception, because it will not protect you against sexually transmitted infections. Now, of course, this is, all right, subdermal implant. So this is next on. This is a thin, flexible plastic implant that contains a hormone called etonorgestrel. The implant is about the size of a matchstick. It's placed under the skin, so subdermal on the upper arm. The advantages are it's 99.9% effective at preventing pregnancy. That's pretty great, right? It provides safe long-term birth control. This is good for 3 years. Providers have to put it in. So, it is a higher cost item, but you're not running back and forth to the pharmacy. You're not paying a copay on a monthly basis. Adolescents don't have to remember to do anything every day or week or month to stay protected from unintended pregnancies. And it contains progesterone, a hormone that prevents the ovary from releasing an egg. The disadvantages with the subdermal implant I see are more, it may cause irregular bleeding. So you might have more intermittent spotting. Now, sometimes this will resolve itself over the first couple of months. Sometimes it doesn't, and patients request to have it out. Less common side effects may include weight gain or headaches or acne. The intrauterine device. Okay, so we've got 2 different kinds of intrauterine device, right? This is a small, flexible T-shaped birth control device. It's inserted into the uterus by an experienced provider. And the 2 types are copper T IUD, which is 99.2% effective at preventing pregnancy. It does not contain hormones. It does not need to be replaced for 10 to 12 years. The levonorgestrel IUD, so Mirena, Skyla, Kylena, Liletta, is 99.8% effective at preventing pregnancy, and it contains a hormone that it contains a progesterone that thins the lining of the uterus, increases the cervical mucus to prevent sperm from meeting up with the egg. And it doesn't need to be replaced for 3 to 7 years, depending on which device you get. The advantages are that it's safe, it's long-term. You don't have to remember to do anything every day, week, month, and to be protected from unintended pregnancy. You may have less cramping or lighter periods with a levonorgestrel IUD. So this is Mirena, Liletta, Skyla, Kylena. And you might not have periods at all. So full disclosure, Mirena IUD is my favorite IUD. I love it. I use it personally. And if you're done having babies, you don't need to have a period. It's fantastic because you don't bleed, you don't bloat, you don't cramp, you don't go down that aisle. It's kind of great. Some disadvantages to an IUD could be that you may have pain or cramping for a short period of time after insertion. With the levonorgestrel IUD, you could have some irregular bleeding and spotting. This often gets better after, over some time. The copper IUD can lead to increased menstrual cramping, spotting, heavier bleeding. And this also usually improves with time. Personally, I find that I take out more than I actually put in because of the heavier bleeding complaint. So if you're someone who has heavy periods already, this would not be my first choice for you. Okay, so let's talk about short-acting contraceptions. There are many kinds that are 90% effective if it's taken properly. They must be used with a condom or other type of barrier protection to prevent sexually transmitted infections. Okay, so a progesterone injection. So this is the Depo-Provera injection. You hear it called Depo a lot. It contains a hormone that prevents the ovaries from releasing an egg. It is 94% effective at preventing pregnancy. You get an injection every 3 months, either in the arm or in the butt. The shot also protects against endometrial cancer and iron deficiency anemia because it's going to cause less cramping, lighter periods. It's going to thin the lining of the uterus. Many patients may stop having periods after several doses. Disadvantages with this one is it may cause some weight gain. Usually it's up to 5 pounds. We can stop it and do something else if we notice that. You may have irregular bleeding or light spotting at first, but typically after the first couple of injections, you may not have a period at all. This may completely resolve. There is some thought that it could affect your bone density. But bone density usually improves after stopping injections. It could increase your risk of blood clots, and it doesn't protect against sexually transmitted infections. And also, when you stop it, you could have a delayed return of ovulation for several months, up to 18 months. And so if you are planning on having getting pregnant in the next year, I would never recommend that you use Depo-Provera. Okay, the contraception vaginal ring. So this is a ring that has estrogen and progesterone, and it prevents the ovaries from releasing an egg. You place the ring in your vagina once a month, stays in place for 3 weeks. You remove it for 1 week to have your period, and then place a new one. The advantages are 91% effective, lighter periods, less cramps. Your acne could improve. Some disadvantages, you might forget to replace the new ring. You could have headaches, nausea. Increase in vaginal discharge is actually a very common complaint that I hear, and breast tenderness. Any combined hormonal contraception could increase your risk of blood clots. And so if you have any risk factors, this may not be the right choice for you. And it does not protect against sexually transmitted infections. And there is an upper weight limit with this. It's around 198 pounds that we think it may be less effective. The transdermal patch. Okay, the patch contains estrogen and progesterone. It's absorbed through the skin. The hormones prevent the ovaries from releasing an egg. You remove the patch and put a new one on each week for 3 weeks. Then on the 4th week, you don't wear the patch, and that's when you get your period. And during that week, advantages, it's 91% effective at preventing pregnancy. You may have lighter periods, less cramps, and your acne could improve. Disadvantages, you might forget to replace your new patch. Also has an increased risk of blood clots. Some people might see the patch if it's not covered by the clothes you're wearing, and this may bother you. And if that's the case, skin, you could also have headaches, nausea, skin irritation, or breast tenderness. If you're swimming a lot, you may find that it doesn't stick well. Obviously, if it's not sticking, then we're not going to have it's not going to be as effective. And so all things to kind of take into consideration. And of course, it does not protect against sexually transmitted infections. Okay, the oral contraceptive pill. I love good oral contraceptive pill because it has so many benefits. Its combined estrogen and progesterone are the 2 female hormones that control the menstrual cycle. The progesterone only pill is another option, and it contains just progesterone. This one requires that you take it every day. You've got to remember to take it around the same time every day. This is not my favorite for teen patients. It's 91% effective at preventing pregnancy, lighter periods, less cramping, improved acne, reduce the risk of ovarian and endometrial cancer. I love it for that reason. It's fantastic if you actually remember to take it. And remember, I said the best form of birth control is the birth control that you'll actually use. So I often have patients set a reminder on their phone or take it at a very common time of day that's consistent for them. So if sleeping late on the weekends, then the morning time is not going to be for you. Okay, barrier methods. All genders should use barrier methods in addition to a method to prevent pregnancy. Barrier methods are going to help prevent sexually transmitted infections like HIV, herpes, gonorrhea, chlamydia, trichomonas, you name it. So we have the external condom. It can be latex, synthetic, or natural material designed to fit over the penis. It's 82% effective. Easy to use, inexpensive. Available without prescription. What's the disadvantage? It could break or slip off during sex. Could have an allergy to the latex. There's also internal condom, which is a loose fitting polyurethane sheath with two flexible rings. The one ring fits inside the vagina, anus, or mouth, and the other fits on the outside. This is 79% effective at preventing pregnancy. It can be used in combination with other methods to prevent infection, and it can provide added protection against pregnancy. Can be difficult to insert, and it may slip, and it can be more expensive than external condoms. Okay, dental dam. Who has ever heard of a dental dam? It's a latex or synthetic sheet that's a barrier users place over the penis, vulva, vagina, mouth, anus, or any other body part. Doesn't require a prescription, protects against infections during oral sex. Disadvantages, we don't know how well it works, right? And then last week I talked about emergency contraception, which is available without a prescription, even for adolescents. It works up to 72 hours after sex to prevent pregnancy. Disadvantages, timing is really important. It doesn't protect against sexually transmitted infections, and it may cause nausea or vomiting. Other methods that you may hear talked about, the withdrawal method, which is when the penis is removed from the vagina before ejaculation. 78% effective at preventing pregnancy. Even if it's done correctly, the penis releases fluid into the vagina before ejaculation, and this fluid contains thousands of sperm. So you notice that with each method, we're getting a little less effective. Fertility awareness method, or your natural family planning. This is when a woman tracks her period, takes her temperature each morning, inspects the color and texture of the cervical mucus each day, and during the week she has signs of ovulating, she's going to avoid sex. This is 70% effective at preventing pregnancy. Okay, and then we have spermicide. So this is a gel, a cream, or a foam that a woman inserts deep into her vagina before having sex. It can be messy and difficult to use. It can be used with other methods to help prevent pregnancy, but it could increase the risk of HIV for those who are at high risk, and it's only 72% effective at preventing pregnancy. Okay, that was a lot. So what are the combined birth control methods? You've got birth control pills, the birth control patch, the vaginal birth control ring. Those are our combined methods that contain estrogen and progesterone. The combined methods work to stop ovulation. So the release of the egg from the ovaries, they stop that. With typical use, meaning the method may not always be used consistently or correctly, 9 women out of 100 will become pregnant during the first year of using these methods. So that's about 9%. The benefits of the combined hormonal methods: you might have lighter periods, shorter periods, more regular periods. It can help with menstrual cramps. It can decrease the risk of cancer of your uterus, ovaries, colon. It can increase or improve your acne and reduce unwanted hair growth. It can also be used to treat disorders such as fibroids and endometriosis. And it can be used continuously to reduce the frequency of migraines associated with your menstrual cycle. although it can't be used if you have migraines with aura. It can also be used to treat heavy bleeding and pain by stopping the menstrual cycle. So lots of great benefits. What are possible risks of using combined hormonal methods? They may be associated with a small increased risk of deep vein thrombosis, so having a blood clot, a heart attack, a stroke. The risk is higher in some women, including women older than 35 who smoke more than 15 cigarettes a day, or women who have multiple risk factors for cardiovascular disease, like high cholesterol, high blood pressure, diabetes, a history of a stroke, heart attack, or a DVT, or a history of migraines with aura. You can't use combined hormonal methods during the first 3 weeks after delivery because the risk of a DVT is higher in the week after childbirth. If you have additional risk for a DVT, you should wait to use combined hormonal contraceptions until the first 4 to 6 weeks following delivery. The risk of DVT also may slightly be higher in women taking pills containing progesterone called drospirenone, and in women using the patch. However, the risk of DVT is higher during pregnancy and in the weeks after childbirth than when taking the birth control pill or using the patch. Oh, great question is, can I use combined hormonal contraceptive methods while I am breastfeeding? If you are breastfeeding, estrogen can affect your milk supply. So it's recommended that you wait until the 5th week after delivery to start using these methods when breastfeeding is then well established. Also, you might consider Slind, which is a new progesterone only birth control. Whereas previously we just had the mini pill and it wasn't that effective. Just drospirenone, Slind, is actually working very well and should not impact your milk supply. There's a lot of different kinds of combined hormonal pills these days. 21 pill day pack, where you take for 21 days, you wait 7 days before starting a new pack, or 28 pill day pack, where you take an active pill for 24 days and then you have a 4-day window to have a period. You have a 90-day pill pack where you take it continuously. And have a period the last 7 days of every 3 months, or a 365-day pill pack where you could take it each day of the year. And in time, your bleeding may be lighter and even stop. Very common side effects of combined hormonal birth control pill: headache, nausea, breast tenderness, or breakthrough bleeding, especially if you're taking the continuous method. Okay, let's talk about postpartum birth control. If you are not using a birth control method, it is possible to get pregnant very soon after having a baby, even if you're in that postpartum period and you're nursing. Many experts recommend waiting at least 18 months between pregnancies before having another baby. If you're not breastfeeding, you could ovulate within a few weeks of childbirth. If you are breastfeeding, ovulation is usually delayed at least 6 months. Once ovulation comes back, then you can get pregnant again. And for most women, ovulation occurs 2 weeks before their period starts. This means you could get pregnant even if you weren't intending or you had not yet had your menstrual cycle. A good time to choose your birth control method you'll use after pregnancy is while you're still pregnant. So these are conversations you should be having in your 3rd trimester with your doctor or midwife. Many methods can be started right after you have a baby, but some also, or, like in the hospital before you leave, but others you need to wait until your milk supply is well established. If you're breastfeeding, there's only a few methods that are not recommended during the first weeks of birth control because there's a small chance that they could affect your milk supply. The method you use before pregnancy may not be the best choice for your use after pregnancy. For example, the sponge or cervical cap that you used before may be less effective once you've given birth because your anatomy could have changed. Okay, and I do want to say about the progesterone only pill that they work mainly by preventing fertilization of the egg by the sperm. They must be taken around the same time every day. If you miss a pill more than 3 hours, you'll need to use a backup method for the next 48 hours. And progesterone only pills can be started right after childbirth. And so this is why I mentioned Slind. Slind is a great option because it does have a 24-hour window, just like your regular combined or hormonal contraceptive pill. Okay, what about breastfeeding as birth control? Because I know I've heard this before. It's called lactational amenorrhea method. It's a temporary method of birth control based on the natural way the body prevents ovulation when a woman's breastfeeding. It requires exclusive frequent breastfeeding. The time between feeding shouldn't be more than 4 hours during the day or 6 hours at night. So this is not practical for many women. The benefits are it's natural form of birth control, it doesn't cost anything, but you might get pregnant during this time. It's unclear whether pumping breast milk decreases the effectiveness of lactational amenorrhea. All right, so, and we talked about sterilization, which is the permanent method of birth control. And women, sterilization is performed by closing off or removing the fallopian tubes. It's 99% effective. Postpartum sterilization that's done soon after delivery, is made through a small incision in the belly. Anesthesia is used. If you have a cesarean section, it could be done at the same time through the same incision. Some hospitals don't offer sterilization, so it's a good idea to check beforehand if you're interested in this option. And then laparoscopic sterilization is what is done as a separate procedure several weeks after you have your baby or years after, depending. It uses a device called a laparoscope. So we're putting the camera in the belly, identifying the fallopian tubes, and we're either making small incisions in the fallopian tube to cut out a middle segment, or we're removing the entire fallopian tube. Oh, and hello, let's not forget vasectomy. Vasectomy is also an option for the male partner. It's easier and safer procedure to perform than female sterilization. It takes about 2 to 4 months for the semen to become totally free of sperm, and a couple needs to use another birth control method to avoid sexual intercourse until the sperm count is confirmed that there's no sperm present. So you still got to use backup. It is a long-term permanent sterilization, but there's a little lag time between the actual procedure and the effectiveness of the procedure. The most common complication of permanent sterilization, so having your tubes tied, removing your tubes, is actually regret. So we like to make sure that we've had a detailed conversation, discuss the risks and benefits, know your family plans, that you understand that it is permanent, that it's not intended to be reversible. Now, If your tubes are completely removed, it's absolutely not reversible. If you had a section removed in the middle of the fallopian tubes, could you have it reanastomosed? Could you have it sewn back together? Yes. But then how effective is it? Is there scarring to the tube? Are you more likely to have an ectopic? There's so many other issues that potentially get into. So we like to make sure that you're absolutely certain that you do not want any more children before we would perform permanent sterilization. Okay, so birth control can help you prevent pregnancy when you don't want to have a baby. Male and female condoms are types of birth control. Okay. All right, that is a lot of information today that we covered, right? Birth control, also known as contraception, can help you to prevent pregnancy when you don't want to have a baby. There are many methods available. The male and female condoms are the types of birth control that can also help you protect you and your partner against sexually transmitted infections. Choosing the right birth control method for you is a very personal decision. Each type of birth control has its pros and cons. There's many things that you need to think about when choosing your birth control. Are you going to use it? Do you want to have children someday, and how soon? Do you have any health conditions? How many sex partners do you have? Do you also need protection from HIV or other sexually transmitted infections? How well does the birth control method work? Are there any side effects? And will you be able to use it correctly every time? So taking all those into consideration after a detailed counseling with your provider will allow you to make the best decision. And you don't have to get it right the first time. I mean, obviously we don't want to have an unplanned pregnancy, but what I mean is if one doesn't work for you or it causes irregular spotting or you can't handle the nausea, we can always switch to a new method. We can work with you in finding out which one works best for you and your body. Some people are super sensitive to hormonal methods, and some people get on the pill and just do great and barely hear from them. So I hope that you found this informative. It is a lot of information to take in, but I hope that it empowers you whenever you go to see your healthcare provider to have a better idea of what are the pros and cons, what are all of the options, and what are you thinking you might want to use, and will allow you to have a more efficient conversation with your healthcare provider. As always, I want to empower you to take care of your health and to be your own healthcare advocate. And then if you're in the Dallas-Fort Worth area, you can always see us for your full service gynecology needs, where we provide concierge care to allow you to live your best healthy life. Until next week, be well.